Let us discuss how could be the inner structure of blood vessels related to the blood pressure. So let's draw a relation between the various blood vessels as the blood flows through the aorta, through the arteries, arterioles, capillaries, venules, veins, and the largest vein like the vena cava. And what would be the mean blood pressure there in millimeters of mercury? So here is 120, 100, 80, 60, 40, 20, 0. In the aorta will be the highest blood pressure. Relatively high will be also in the arteries. In the arterioles, usually get already lower blood pressure. In the capillaries, there is a drop of blood pressure. So the curve looks like that. There's a significant drop of the blood pressure in the microcirculation. And the blood pressure in the veins is very, very low. It might be even slightly negative in some veins. The details will be discussed in your physiology classes. However, let's consider the proportions of the lumen and the wall thickness. The aorta is a ring with a diameter of approximately 20 to 25 millimeters, and the wall thickness would be like 2 millimeters. In arteries of various size, the diameter could be, for example, 4 millimeters, and such an artery has a wall thickness of approximately 1 millimeter. In arterioles, with a lumen of diameter between 20 and 100 micrometers, the wall thickness is identical with the diameter. So the muscle in the wall can regulate the diameter pretty much. The capillaries, let's say the typical capillaries, have a diameter ranging between 7 to 10 micrometers, and a wall consisting of endothelium only with a thickness of approximately 1 millimeter. Then we approach the venules with a diameter between 20 to 200 micrometers and a thickness of 2 micrometers. The veins with the 5 millimeters diameter would have the wall thickness of 0.5 millimeter, and the largest veins like the vena cava ranging between 25 to 30 millimeters in diameter have a wall thickness of like 1.5 millimeters. If we want to estimate the quality of perfusion of the peripheral tissues, let us discuss something similar. That would be the Ohm's law, where the resistance equals the voltage divided by the electric current. So if we use the resistance as the systemic vascular resistance, That's the resistance against which the heart has to pump the blood. The voltage would be the pressure across the circulation, the pressure difference, and here would be the flow through the vasculature. That will be actually the cardiac output. So, the resistance equals the pressure across the circulation is the difference between the mean arterial pressure and the mean venous pressure. And divided by the cardiac output. So you want to express this mean arterial pressure, resistance times cardiac output plus the mean venous pressure, if we express this from the equation. And this is hard to measure, but we have a very good approximation. It's the diastolic pressure plus 1/3 of the difference between the systolic pressure and the diastolic pressure. So, as an example, for a person with a systolic pressure of 120 millimeters of mercury and diastolic pressure 80 millimeters of mercury, the mean arterial pressure would be diastolic, that's 80, plus 1/3 of the pressure difference, systolic minus diastolic, and that would be approximately 93 millimeters of mercury. So that's the integrated pressure that provides the sufficient perfusion of the organs.